Hi, my name is Valerie Wood, and I'm your instructor for Advanced Clinical Assessment and Diagnosis 1. Welcome. In this intro video, I'm going to give you a brief orientation to the course, offer some guidelines so you'll know what to expect. I'm going to tell you a little bit about me and my background and my thoughts on assessment and diagnosis and what I'd like you to consider as a foundation from which to build each case upon as you begin this work. In the DSM-5 section, Use of the Manual, its collaborators write about clinical utility. They emphasize the importance in utilizing diagnosis to determine prognosis, treatment planning, and potential treatment outcomes. As you work through the content of this course and construct diagnostic workups, it's important to keep this in mind. Treatment planning begins at assessment. I teach both clinical courses at Fordham as well as service field faculty advisor, an opportunity which I really appreciate because it allows me to participate in the field aspect of your program, the place where you take the skills provided here and develop them into practice behaviors. Personally, I've benefited from seeing students I've advised develop into their roles of social workers, gaining competence, confidence, and the respect of their colleagues in the field. As far as clinical courses, I'm currently teaching this course. I also teach part 2 of this course, Advanced Clinical Assessment and Diagnosis 2, and I teach a seminar in clinical social work practice. Prior to coming to Fordham, I was with another graduate school of social service where I taught clinical practice levels 1 and 2. This course is the equivalent of generalist practice. I also taught psychopathology, which is the equivalent of this course. At that school, I had the opportunity to provide advisement for integrative seminars 1 and 2 and to do some field coordination for the Northeast region. That was an online program, and I really enjoyed doing that, placing students in field. My clinical background is pretty diverse. I spent 7 years at a suburban hospital working in the psychiatry department doing crisis intervention in the emergency room, and that is really interesting work if you can get it. Crisis screenings are very different than diagnostic interviews, assessments that you might do with a client that you're meeting for prospective counseling or in a residential setting. A crisis screening is usually to facilitate stabilization. You mobilize resources, provide referral, it's quick, there's not a lot of documentation and really no follow-up. You might provide some coping skills to the client and family or refer to medical or transfer to a facility. A transfer always entails a pre-certification for insurance and a complete diagnostic workup, which includes history and treatment recommendations. All of the following is the product of a 45-minute, 30-minute assessment, many times with no collateral information. You need to provide the insurance company with a full diagnostic workup and full assessment, or you won't get a pre-certification for transfer. It's very challenging. I really enjoyed it. The agency goal in that setting, in the emergency room in a hospital, is to get the patient out of the ER. So it's interesting. Following this position, I went to an inpatient substance abuse facility, which was located in an urban setting, and I provided care for low, no income, and criminal justice client populations. The services we provided there were inpatient detox, short, long-term residential, and outpatient. In my role of senior clinician there, I supervised all the master's level clinicians, and I specialized in co-occurring disorders. Prior to that, I was with the Suburban Mental Health Community Agency, and there I served as clinical director. I diversified there and did less face-to-face client work. I supervised the staff, and I got involved in program development, strategic planning, and board development, which I really enjoyed. From there, I went to the University of Southern California, which is where I was before I came to Fordham, and I was there full-time and focused on my private practice, which I've maintained since 2005. You know the rest. Now, most importantly, I have 3 teenage boys. One is a junior at George Washington University. I have a senior in high school and another one who just graduated from high school. My guys are really the greatest. So for this course, we have a curriculum which is outlined in the syllabus. The syllabus is posted, and I'd really like you to spend a lot of time with it. Spend a significant amount of time in it. We are going to adhere to it throughout the session. Please contact me immediately if you have any questions about anything. Don't ever hesitate to reach out to me. There are 2 quizzes and a final exam, and you'll be provided with a review for the final. I'm going to have you submit case formulations on the discussion boards. I think there are 5 scheduled right now. We might do more. That really is the meat of the course. That's where the work is, and how you'll learn through coming up with your own diagnostic workups and evaluations, and this will factor into your class participation grade. And one thing that I really want to emphasize to you is I find students are hesitant to diagnose, and in this class when I teach it, and I need to tell you that if you don't diagnose, you're not going to learn anything. So you're going to be given a certain amount of information, a limited amount of information, and you're going to need to come up with the best diagnosis based on the information that you have. So don't be hesitant. If you tell me that you don't have enough information to diagnose, or that you are, abstaining, then you're not doing the class. So you need to come up with a diagnosis and work with me. I'm always available to you if you need to talk through something, or you want to, get some ideas. We are using the Maximum text. It's required. It's this book. There is a third edition which you may not use. This book actually incorporates the DSM-5, which everyone is using now, and so we're not really going to be doing anything with the DSM-4. If you want some help, in terms of changes, or converting from a multi-axle system to the DSM-5, which is, really doesn't break down based on, acute diagnosis, personality disorder, medical problems. We do look at all of that, but we just don't lay it out in the same way. So we can talk about the changes from DSM-4 to 5 if that's helpful to you. If not, then we don't need to do that. The DSM-5 is required, and there is a version which you can access through the library, and it's very useful, and it has a lot of information also linked there. You have assessments. There's the you go to the book and take a look through it, spend some time with it, but we'll be using the DSM-5 a lot in this course. As far as the organization of the course is concerned, some of you may know Dr. Manoj Pardesani. Dr. Pardesani was an integral part of the course design, and he does a really good job with the content of the course. I've decided to leave many of the videos he's created intact. I really like his style, and I believe the introductions fit well with the content that follows. And you'll see when you watch some of his videos, he's a little more comfortable on camera than I am. And he makes it very interesting. He's very easy to watch. I may pop up in a video here and there, and we'll have the opportunity to also meet in virtual office hours, which I will hold regularly, and I will let you know when those will be held. I'll say I'm holding virtual office hours on Friday night from 7 to 8:30, and you just pop on and I'll be there. I can also meet you in the Westchester campus if you think a personal face-to-face meeting would be helpful to you. I want to do whatever it takes to help you get through this class. It's a lot of fun, and I want it to be fun for you too, because it certainly is for me. So you'll be seeing enough of me. Now it's your turn. There are instructions posted for you to offer a little information about your background and to tell us something about you. There's also a function there for recording a video in the discussion forum, so I'd like you to do that, please. I'd rather see your face and hear your voice than have you type your response on the discussion board. Please utilize that feature when you're creating your introductions. So here we go. We're off. I can be reached via email. That's the best way to get me. My contact information is posted in the syllabus as well as in the intro form, I think. But you have my phone number. If you don't hear back from me within a day, call me. And if you have something that you need an answer to in order to move on to the next step, then I don't want you to wait for me to respond to an email. You can text me or call me. But don't hold on something because you're waiting for me to get back to you. I'd like you to just kind of keep things moving. So fasten your seatbelts. It's going to be an exciting ride, and I will see you on campus.